Hello everyone, I'm Dr. Tanvi Sood. I'm consultant medical oncologist at Paras Cancer Center, Gurgaon, and today we are talking about colorectal cancer. So typically it occurs in older adults, that means age more than 50 years, and advanced age is also a high risk factor for cancer formation. But now it has been seen that in the last decade, even younger adults, that is age less than 50 years, have also started developing these cancers. So it has become of utmost importance to talk about it and how do we catch it early. So when we talk about catching it early, there is a strategy called screening. It is typically done in people who don't have any symptoms. These cancers, they start in the form of something known as a polyp that can happen anywhere in the colon. These polyps are small lesions, they are asymptomatic, typically don't have any pain also. So they take a long time to convert into cancer. We have an advantage. We can take advantage of this gap and perform screening strategies during this time and catch these lesions even before they turn into cancers. Screening can be done by using different types of tests that are available in hospitals very easily these days. Something known as a stool occult blood test. So that is basically checking if there is any bleeding, microscopic bleeding that might be happening inside the colon through these polyps or any early cancer, and it can be passing out in the stools, which maybe the person is not able to see as frank blood, but when we do tests in the labs, it can be seen that there is some blood detected in the stool also. These kind of tests can be done once a year, and normally we recommend that in all people above the age of 45 years, some screening strategies should start off. The other type of colon cancer screening is colonoscopy or a flexible sigmoidoscopy. So these are endoscopies that are done directly under vision. The advantage in this kind of a strategy is that the gastroenterologist who is performing the endoscopy is able to actually see the polyp or the cancer under vision, and in the same setting they can remove the polyp also, or if there is any early cancer lesion detected, they are able to even take biopsy in the same setting itself. So these kind of colonoscopies or sigmoidoscopies, they can be done once in 5 years, and these are typically started 45 years onwards. So this I'm talking about people who don't have any history in the family. There are no high risk factors. High risk factors such as whether there is a positive family history, somebody in their family already is diagnosed with cancer of the colon, or if there is a known familial tendency, something known as inherited cancer syndromes, which are very rare but they are existing, and we are starting to detect them more and more with the help of molecular testing in our patients. There are families in which there is colon cancers running through generations, and typically these kind of people, they present at a much earlier age also. Other kind of high risk factors are if there is somebody who received radiation sometime in their childhood, maybe because of some other malignancy, and later in life they can also have a higher tendency of forming colon cancers later in life. So these are the high risk individuals in which the screening strategies, they usually start 10 years earlier from the date of diagnosis if there is any family member that was diagnosed with cancer. So if somebody in their family got it at 50 years, they should ideally start getting themselves checked from 40 years onwards and not wait for the age of 45 years. So this was all about screening. But what happens when somebody has already developed cancer? So talking about symptoms very briefly, if there is someone in your family or you yourself are suffering from persistent crampy pains in the abdomen that is not going away with painkillers also, persisting for weeks, months, if it is associated with altered bowel habits, which means that it is alternating with diarrhea, sometimes constipation, not getting resolved on regular medications, lasting for many weeks, if there is any unexplained weight loss, patient is losing their appetite progressively, if there is any presence of frank bleeding, if there is PR bleeding, per rectal bleeding, or if there is any blood mixed in the stools, these are telltale signs and you should immediately see a doctor, because you need further evaluation to find out whether all these symptoms are related to a colon cancer that is slowly developing in the body. Like I told in the beginning of the talk also, that about 60% of the patients, they are coming to us in advanced stage. So definitely we want to talk a lot about prevention and screening strategies, but we also want people to be aware of their symptoms and report to the doctor as early as possible, because once we catch colon cancer with the help of CT scans, with the help of colonoscopies and biopsy confirmation, we get on to other tests known as PET CT scan, which help us in staging the colon cancer. Now, as we are all aware, it can be stage 1, 2, 3 or 4. We want more and more patients to be aware of this cancer so that we can catch them earlier. Typically, because stage 1 to stage 3 are curable cancer stages, we can offer these patients surgeries also. These patients can receive chemotherapy to prevent any future recurrences as well. But there are very limited people in the stage 4 subset who can be offered surgery also. If the cancer is limited just to the liver, if it is limited spread, even then in that situation, we don't lose hope. We are able to offer patients with surgical options, and we can treat them on further chemotherapy, and nowadays there are even biological therapies that we use. With every patient that comes to us in the stage 4 setting where the cancer has already spread outside the colon, we are performing something known as molecular tests. This is mandatory in all our patients now. So molecular tests help us in deciding which biological or targeted therapy is the best combination with chemotherapy. And it has been seen in ample evidence across all studies around the world that these molecular therapies along with the chemotherapy give a very good treatment response and a very good survival advantage to our patients also. So I just briefly spoke about the colon cancer, what the symptomatology is, how do we go about screening, and how do we briefly treat our patients also. But wouldn't it be great if we are able to overall prevent it? So to prevent it, we should be aware of what are the high risk factors, what can cause colon cancer in an individual. So just to broadly divide it, there are modifiable factors and there are non-modifiable factors. So let's talk about some prevention strategies. Prevention strategies are usually circling around our lifestyle modification. The most important thing is what kind of food we are eating. So lifestyle modification primarily focus on nutrition-based food, balanced diet which is rich in fiber, which is rich in vitamins and antioxidants. So it is seen that a diet that is rich in vegetables, fruits and low on red meat consumption, this kind of diet is very favorable in preventing colon cancer in the long term. This also helps us in preventing the second factor which is a high risk, that is obesity. So obesity and diabetes are known to be linked to cancer formation, especially colorectal cancers. When we indulge in a healthy diet, when we indulge in a healthy lifestyle that is not a sedentary lifestyle, we are able to maintain a good healthy weight also. So preventing obesity is another very important preventable strategy. Then the third one is, of course, when I talk about exercise. Exercise is any amount of moderate exercise in which we get our heart pumping, the respiratory rate goes up. Any exercise that gives around 30 minutes of duration, maybe every day or a minimum of 5 days a week, is more than enough in avoiding a sedentary lifestyle and in preventing colorectal cancers. This is all evidence based and it is proven that exercise, a good diet, all these dietary factors, lifestyle factors help us in preventing colorectal cancers in the long term. So this is all about factors that we can control. But what about factors that we are not able to control? These are non-preventable, but it is good to have information about them. So mostly it is inherited cancers. Inherited cancers are, like I talked about, the cancer syndromes that run in families. Now there are specialized tests that we do to look for these kind of familiar colorectal cancers. Some of them are known as like Lynch syndrome, which we regularly test for in our patients also. Especially families that are carrying history of colon cancers, it is possible that at a very young age, other family members can also develop colorectal cancers. So these are high risk individuals. There are other high risk factors also, that if there was exposure of radiation sometime back in life because of any other cancer treatment also. So these kind of individuals can also have a high risk for formation of colorectal cancers in the future. So these are the factors that we know about. And now with the advancement in treatment strategies, in molecular testing and also in screening strategies, with raising awareness, we are able to move towards colorectal cancers becoming a curable cancer. Thank you so much.